Hello, Mike Bentz in Madison, Wisconsin, here for PRS, discussing the journal article, Botulinum Toxin to Improve Results in Cleft Lip Repair. I want to congratulate the authors on a very interesting study. Their hypothesis was that upper lip wounds that lie perpendicular to the relaxed skin tension lines are subject to repetitive dynamic stresses associated with orbicularis oris contraction and therefore may lead to unsatisfactory scarring. While this is a paper that addresses cleft lip repair, you can imagine this would also be applicable for Mohs reconstructions and other types of soft tissue reconstructions. This was set up in a really elegant way as a double-blind, randomized, vehicle-controlled prospective trial of 60 patients, of which 59 completed the trial, so a very good sample size that was calculated based on statistical methodology. The patients were assessed using the Vancouver SCAR scale as well as a visual analog scale using photographic measurements and subjective interpretation of expert and layperson evaluators. The outcome of the study showed that there was a significant difference that was demonstrated, indicating the scars are both objectively narrower, this is by measurement, and subjectively better looking using the visual analog approach. The outcome of this in this patient population theoretically portends a better long-term outcome in terms of camouflaging and improving their scar, and thus the social impact of having a cleft lip and the identification of that. But you could imagine this could well be extrapolated into reconstruction in other modalities such as Mohs reconstruction or traumatic lip reconstruction. This is a very interesting paper in that it takes a known and acceptable intervention in cosmetic surgery, applies it to our reconstructive approach for cleft lip and cleft lip repairs in order to continue our optimization of those scars for our cleft patients. This is a very unique and very thoughtful study that follows the observation many years ago in several other articles that this might be a possibility. This is the first paper to show that. I think that they have shown that it can be done safely and with efficacy to improve outcomes. There were no complications suggested to include oral continence loss or dysfunction, breathing problems, and thus this would seem to be a safe intervention, not only an efficacious one. I want to congratulate the authors on this interesting paper that was beautifully designed and implemented in a fashion that gives us reliable data and another stimulus towards improving our cleft lip and reconstructive outcomes. Thank you for the opportunity to discuss this paper.